Good afternoon. My name is Kendra White, and I'm Senior Manager of Community Relations for UPMC for Life. Today, you're joining us for the Staying in Touch series, Episode 5, How to Cope with Depression. The Staying in Touch series was designed to be here to show that we're here for you to stay connected and informed during this challenging time. We are happy that you have taken your time today to join us to hear from some of our experts in the fields of preventive medicine, mental and physical health, and other specialties about how to stay healthy, manage stress, be active, and connect with your community, all from the comfort of your home. Our program will last for about 30 to 45 minutes today, and before I introduce today's presenters, I want to start with a quick poll question for our audience of listeners. The poll question I'd like to ask today: has the worry you have experienced during the recent pandemic made you feel sad or blue? Press 1 on your telephone keypad for yes. Press 2 on your telephone keypad for no. And if you're joining us via the online platform, you'll see a new poll question is available, and you'll have the option to vote accordingly. So again, has the worry you have experienced during the recent pandemic made you feel sad or blue? Yes, press 1 for yes, and press 2 for no. I would also like our audience to know if at any time you would like to ask a question for our presenter, you can press star 3 on your telephone keypad to be connected to someone from our team who will take your question and be able to share that with us. If you're joining via the online forum and decide to type in a question there, please provide your name and an email address or phone number where we can get back to you, as that information is not provided automatically. And if we do not get to answer your question on the live call today, we will be given a log of all of these questions after the call, so that our team of professionals will be able to follow up with you, whether it's a question, a comment, or a need, accordingly afterwards. If you have questions specific to the COVID-19 virus, we ask that you visit our website at www.upmchealthplan.com/COVID-19. So again, that's star 3 if you're joining today via the phone. We'll connect you with someone for your question or comment. And we also welcome any ideas that you may have for future topics. These programs are created with you in mind, so we certainly welcome your feedback. So now I'd like to introduce our speakers. Joining me today are Dr. Bills and Dr. Silbert. And Dr. Bills is a Senior Medical Director for Integrated Care and Trauma-Informed Practices with Community Care Behavioral Health. She completed an internal medicine and psychiatry residency, as well as post-traumatic stress fellowship at West Virginia University. Dr. Bills supports the CCBH Behavioral Health Home Plus model, primary care behavioral health in federally qualified health centers, a trauma-informed care center project in North Central PA, and many integrated care initiatives with CCBH. And also joining me is Dr. Richard Silbert, who is a Senior Medical Director with Community Care Behavioral Health. He is Associate Professor of Psychiatry at the Commonwealth Medical College and is a practitioner whose interests focus on the assessment and treatment of addictions, particularly when seen in co-occurring disorders and healthcare professionals. For the last 13 years, he has been Senior Medical Director of CCBH, with duties that involve 7 counties in Northeast and Pocono areas of PA. And he remains active in the community through numerous presentations that he gives regarding addiction services, suicide prevention, and recovery initiatives at psychiatric hospitals, and presentations as well for general medical community. So we have wonderful speakers today, and I think that I've talked enough. So welcome today, Dr. Bills and Dr. Silbert. Thank you for joining us.
Hi, thank you. And this is Dr. Bills. Welcome, everyone. And for today's episode, we're going to be focusing on what depression is, the symptoms, risk factors, how depression becomes high risk, ways to protect your mental health, how to get help, and then we'll be taking your questions.
Thank you, Dr. Bills. This is Dr. Silbert. Like Dr. Bills, I'm thrilled to have at least a little less than an hour together with you all to hear your concerns and hopefully offer you some useful information and some coping strategies. When it comes to the question about what is depression, I always ask people to remember that depression is not simply a character defect. It's not people being weak. It means that a person has chemical changes in their brain, and the chemicals or neurotransmitters, as doctors call them, change and get lower, and sometimes they get higher, but usually lower. And that means that depression's going to wind up affecting your mood and giving you feelings of sadness and loss of interest. The worst thing about getting sad and losing interest is when it makes you feel life's worthless, and that is a distortion in our thinking. And the big worry, of course, is the depression getting to the point of getting suicidal ideas. Now, Dr. Bills and I are both going to talk about how depression affects you physically, and before she talks more about this, I want to remind you that depression can change your energy, can change your eating. It affects your body system. So we're going to talk more about that, whether it's your heart, cardiac system, your gastrointestinal system, even your pain tolerance. Now, depression's very common within our lifetime, but please keep in mind that depression's treatable, and even if we can't 100% cure it, we can make it pretty darn manageable for folks. And again, since it's common, let's keep in mind that for women, that means roughly a quarter of women, up to 26% of women in their lifetime will have depression. And according to the American Medical Association, about 12% of men in their lifetime will get it. And in any particular year, about 7% of folks will have depression. But if you're already in the hospital or in a nursing home, the percentages are much higher than that. My biggest concern is that there's a whole lot of folks that don't get treatment. It's thought to be somewhere about a third of folks who have depression don't get treatment. And hopefully you'll get some information now from both Dr. Bills and myself, and she's going to go over some with you what the symptoms of depression are. Dr. Bills?
Thanks, Dr. Silbert. So yes, I'm going to talk a little bit about symptoms of depression. So along with a depressed mood, there are some other really common symptoms that could make you think that depression might be an issue. Certainly feeling helpless or hopeless, losing interest in kind of the usual things that you might do, or not being able to have pleasure or enjoy things that you are normally doing. That would be a tip-off, and that could include a loss of interest in having sex. Appetite or weight changes. So it could be loss of appetite, and then sometimes when people will have enough sustained loss of appetite, they can have weight loss. But it could also be increased appetite, and with that could come an increase in weight. So those kind of either extreme could happen. Certainly sleep changes are pretty common with depression or problems with sleep, what we call sleep hygiene. You might have heard of that. Sleep hygiene is the idea that you have a routine just for sleep, and the sleep changes that go along with depression can be both a loss of sleep, not enough sleep, or too much sleep. Then some other symptoms would include anger or irritability, and a person could be very agitated, but it's also possible that along with the mood changes, somebody could have a very diminished energy or even appear slowed down. Fatigue, a complaint of having kind of extreme fatigue and just no energy, that could be common. Self-loathing, feeling worthless or having a lot of guilt, thinking a lot about things that have happened, or just overthinking episodes or events in your life could certainly come up and make a person feel very negative, more negative, especially when they're feeling depressed. Trouble concentrating is very common as well, and certainly that can come up and show itself in the school or at work, and even in any type of activity. Trouble concentrating could really interfere. Unexplained aches and pains, Dr. Silbert was talking about that, so a lot more physical symptoms, or even an excess in worry or concern about health issues could be there. Reckless behavior would refer to possibly somebody who's doing things they wouldn't normally do, maybe higher risk types of activities, maybe even using substances that they hadn't used before. So sometimes that can show up with somebody when they're suffering with depression.
Thank you, Dr. Bills. We're going to talk for a few moments about the risk factors for depression. I noticed one of the folks attending put in already a question about would decreased stimuli or sensory input increase the risk factor for having depression. And I know, as a person who personally is hard of hearing, sometimes when I don't have my hearing aid and I'm not listening to important things around me, I do increase my stress, and I probably do increase my risk. But typically in depression, there's biological risk factors, and that can be how our physical health is doing. Are we in the midst of different physical illnesses? It could mean, are we on medications that have side effects of depression? So many different physical and biological things affect risk. Genetics affects your risk. That's not only what happens in your family, of other people in your family have had depression, and that leads to stress, but also the heredity towards it. And of course, psychological factors affect the likelihood of getting the depression. Some people by nature are more positive, and other people are more negative, and some people have very strong feelings, like most of us, about wanting things to be uncontrolled, and life doesn't always cooperate with that. So that adds to a combination of different risk factors. Risk factors also involve life events and stressors, and we could be having a hard time in a very significant relationship that we're having. And of course, people are concerned these days about financial strain, and that's a risk factor. And our overall health conditions is a risk factor, and trauma and having losses in our life are risk factors. Now, it may seem strange, but when I've looked at certain data that foundations for working on depression and suicide prevention offer, but pandemics and disasters, they don't always lead to the very worst form of depression, getting suicidal ideas, or people making attempts to end their life. Maybe that's because we have within us the ability to bond together, to care about each other. And typically during very bad disasters, including back when there was 9/11, at least temporarily, some suicide rates and depression rates temporarily go down. Of course, we want to keep looking at when and how that affects folks, and and keep an eye that the stress and the upsets don't add up to change our biology and then make depression become high risk. So when we look at the slide that says, how does depression become high risk? Well, it's certainly when life events and stressors mix together with the risk factors I've just talked about. When that happens, when those life events and stressors mix together, it's not that unusual for someone to experience feelings of hopelessness. In the example we gave, a person already has a mood disorder and then they lose their job. That can add a great deal to risk. So a lot of times what we see when people become overwhelmed or hopeless is that we can easily see that they become a person feeling hopeless or even getting some suicidal ideas, but we can't always know, like right on the surface, what were all the things that contributed to these underlying risk factors. Now, to be a little more positive and to talk about coping and protecting yourself, let me turn it back over to Dr. Bills.
And I also want to I would like to remind our listeners, if you do have a question or a comment, you can press *3 on your telephone to be connected to someone from our team that will be able to take your question. Back to you, Dr. Bills.
Oh, thank you. So, sure, I'm going to talk a little bit about ways you can protect your mental health. And so there are several things that are really important, and we've touched on some of these things a little bit so far. But focusing on what you can control, having a routine for eating, sleeping, taking medications, any other important activity, that's really helpful. And sometimes when people start feeling depressed, they start kind of losing those usual routines, and it's important to keep those up. We definitely experience stress when we feel we should be able to control something, but we can't. So that's really important to recognize. That's true for any of us. Another thing you can do is staying connected with family, friends, and community, and there's many ways to do that. So certainly that could be on the phone, safe social contacts or safe social media, certainly the computer, using emails, and of course meeting in person, again, when that can be safe. All of those ways are very important. The next one is about having open and honest communications about what's stressful with people close to you. And I noticed there was a question about whether or not you could have depression or really have some difficulty with feeling depressed, and other people may not be able to notice. And that is actually fairly common. Some people, some of us are a little better at being able to keep some of that feeling less obvious to those around us or outside of us. And so then, that also is a really good thing to pay attention to, because if you're feeling that way and you're not letting somebody close to you know, or letting somebody who can support you know about that, that might feel worse, actually, because then you feel like people aren't aware, and that might stir things up a little bit. So that's a really important one, thinking about how to have some open and honest conversations. And you can even do that with people besides your close network. That's one of the reasons why there are numbers and resources where you can reach out to people that are happy to hear what you have to say about what's going on. And we're going to mention those too towards the end. Practicing self-care, also really important. So exercise, You can pick something you enjoy that's doable. It doesn't have to take up a lot of time or be overly stressful, but just that movement of your body is really very helpful for improving mood, and has certainly been considered by many people an effective intervention all by itself. Eating healthy, trying to have, again, that eating routine so you have kind of a regular time to eat, but also what you eat can affect your mood. We know there's a lot of connection between your nutrition and how you feel. Healthy sleep, I mentioned that before about sleep hygiene, so having a routine, trying not to have the TV and computer on when you're supposed to be sleeping, very important. Give your brain a break. Meditating or learning just some way to relax, that's also really helpful, just to calm down your brain and your body. A dose of sunshine, when that's possible, is also very important in terms of moods. There's some people where there hadn't been enough sunshine, or there may be some difficulty with being outside, so some people are on vitamin D3 for that reason, and that's also great. And another good thing you can do is limit the time spent watching the news. That's a really important way to take care of yourself and lower stress. Reaching out to those who may be isolated, so something you can do that is kind of outside of yourself. So seeing if there's people who may need a little extra support outside of you is actually something that can, again, lower your sense of depression. Sometimes when we're able to offer support to others, that improves our self-esteem and how we're thinking about ourselves.
Thanks, Dr. Bills. We're going to continue to talk a little more about ways you can protect your mental health. Now, if any of you have been around places where they work on mutual help or support help, like 12-step groups or other self-help groups, you'll notice what I'm going to say sounds awfully familiar. I've always worked around them and been around them. And they've done things maybe long before psychologists and psychiatrists did to help you challenge your negative thinking. So the ones that have helped me, that came to my mind as we prepared this presentation today, is like when I start to feel negative, I like to make myself a gratitude list. Maybe it's not so obvious, but sometimes I have to sit down and write down or say to myself a few things I'm grateful for. I also try to figure out what I can do and what I can't do. So I may not be able to stop the COVID or the virus pandemic, but I can wash my hands. I can stay at home and follow precautions. So there's things I do have in my control, just like there's things I don't have in my control. I also try to stay focused on what do I have to do today. I know, and I think this happens to most everybody, if I get too far into the future, I'm going to tend to think about things turning out wrong or negative rather than staying positive. So all this type of challenging your negative thinking, I know it often is something that therapists and clinicians talk about doing cognitive behavior therapy, but there's things you can do on your own that help challenge your negative thinking. But at other times, you're going to really need to be in contact with your healthcare providers. And sometimes those kinds of challenging the thinking, you need to have an individual or a family therapist. And at times, our thinking gets so slowed down and so distorted by depression that we do need to go on to medications. And medications and support, often come from psychiatrists and psychiatrists, but support from psychologists. But we also need to stay in touch with our primary and specialty care providers. Now, when you do this, when you protect your mental health, you're not only helping your mood, but you're helping your physical health and you're helping your immunity be better. I'm going to turn it back over to Dr. Bills to speak more about what are the online resources or the apps or the support groups that can also help you protect your mental health.
Thanks, Dr. Silbert. So I'll just start off before I get into the different resources that you can check into. I'll just say that it is important to recognize for yourself what things may feel different. Dr. Silbert was covering a lot of this and things you can do. We've both been talking about that. And especially during a time when this COVID and the pandemic are increasing kind of everybody's general stress, you sort of have to recognize that for anybody, that impact can change some of your mood and some of the way you think, and it sort of affects us mind and body. And if those changes are enough to cause us to have some difficulty in some of the symptoms that I went over, then it may be a good idea certainly to reach out and check into some of the resources I'm going to mention. So there are a lot of telehealth and remote options available, so just a couple I'm going to mention. There's the Substance Abuse and Mental Health Services Administration has a Preventing Suicide website and many resources on help for mood and depression there. The Depression and Bipolar Alliance is a great resource. They have a lot of educational materials, a lot of self-help material, and then also information about online groups. The National Alliance for Mental Illness, we put on here the link for the Keystone or Pennsylvania chapter, and they have specific resources certainly related to stress, dealing with the coronavirus and depression, and they have local chapters. You may already have been in touch or have connection with your health provider or a specialist like a therapist or psychiatrist using telehealth, and that's a great resource, especially right now, and those that access is certainly available. And there are mobile apps such as Brain Manager, and you might already be aware of that. Another thing is if you're in crisis or you know somebody who needs more urgent help, there's a text crisis line. And also the Suicide Prevention Lifeline is available. The crisis text line and the Suicide Prevention Lifeline are available around the clock.
Thank you. Thank you so much, Dr. Bills. I was just looking through some of the questions that we're getting as they're coming in from our listeners. And I think, everything that you have mentioned, there's some really great tools out there. Final reminder, if you have a question, you can press *3 on your telephone keypad and be connected to someone that will take your comment or question for our team. Dr. Bills mentioned the Brain Manager app. You can download Brain Manager in the Apple App Store or the Google Play Store. And once you create an account, the access code is CALMNOW, CALMNOW. And that's for the Brain Manager app, which is a huge resource. We talked about it a few programs ago. Also, any information specific to COVID-19 can be found on our website, upmchealthplan.com/COVID-19. And also, we have a website set up that houses information on community resources, telephonic counseling, and more. And that's upmchealthplan.com/intouch. You can also find our previous presentation slides for our Staying in Touch series, and those recordings will also be available via the In Touch website portion. I wanted to ask a second poll question before we get to the Q&A. If you're on the telephone, you can press 1 for yes and 2 for no. And the question is, do you feel like you have learned some things that can help you manage or cope better with troubling feelings? Press 1 for yes, press 2 for no. Do you feel like you have learned some things that can help you manage or cope better with troubling feelings? And Dr. Bills and Dr. Silbert, if you're able to look through some of the questions that are coming through, I have to say, one that disappeared on me was something I definitely wanted you all to comment on. Somebody had asked for you to maybe comment on, is it normal to, dealing with this pandemic and the coronavirus, COVID-19 issues that we're having right now, is it normal to feel some depression, being that this is an unusual event? Would you like to comment on that?
This is Dr. Silbert. Sure, this is Dr. Silbert. I'll take the first stab, and maybe Dr. Bills can clarify even further. I mean, I think it would be normal, and I'd even call it expected that there would be stress or fears that are part of our reactions. To think that we'd all deal with it without an extra thought or an extra fear, that would be unreasonable and probably putting ourselves at some risk. I think it would even be normal to have now and then sad feelings or blue feelings. I think it's a matter of degree, and I think that when those sad feelings or blue feelings become kind of round the clock, that's when we wouldn't call it normal. What do you think, Dr. Bills?
I completely agree with that. I think that this high stress is going to impact all of us, and there are many symptoms that we would have, which would be basically a normal reaction to a really stressful situation.
Yeah, and this is Kendra. I just want to chime in where you mentioned, keeping a routine, practice self-care, exercise, eat. Keeping on a routine, I know, has helped me. Because, throughout this, I've experienced some down moments as well, and I know that it feels abnormal, but yet with the situation we're dealing with, it is sort of something to expect, that we have to deal with to know what's right for us and what's wrong. Interestingly, our poll, I want to comment on our poll today. When we first started, 54% said that they have experienced some sadness or feeling blue during the recent pandemic, 54%. And then the second question, after listening today, do you feel like you have learned some things that can help you manage or cope better? 88% said yes. So that's great for you, Dr. Silbert and Dr. Bills. You did a great job presenting today. This is
Thank you.
Very
that's
serious,
cool.
Go ahead.
That's great. That's great news. I'm glad to hear people, are benefiting from that. It probably makes me and Dr. Bills have better moods to hear that good news about the poll.
Yes. And we are getting really great questions and comments coming in, and you all are really opening up with some of your issues, and we will have someone follow up with you in a phone call within the next few hours or within the day. So I just want everyone to know that I don't want to address personal type issues or comments on here on the call for everyone, but I think keeping those lines of communication open are the best thing that we can do right now. A question someone asked about, is it normal to have depression and not have anyone notice? Is that something that you could comment on or that you've experienced?
Hey, yeah, this is Dr. Bills. I touched on that a little bit. I actually think that's pretty common, and it's really difficult, I think, for people, especially if they're struggling with a depressed mood and they feel like it's not getting any better. People don't like to feel that way, and they also get concerned about other people noticing and what, remember I mentioned that thing about self-loathing, and people start being worried about what somebody else is going to think. So that does happen, and it's one of the reasons why I mentioned how important it is to reach out to try to help. That helps with that kind of thinking a lot.
Very true. Here's another question. What is the difference between anxiety and depression? And can anxiety lead to depression?
I know, Kendra, this is Rousseau, but I'll take the first stab at that and see if Dr. Bills has anything else. I mean, I think there is a relationship. Usually, anxiety, when our nervous system gets stressed and gets, in some sense, too tuned up, is a separate disorder. But a whole lot of folks who've had anxiety and stress over too long a period of time are much more likely to be susceptible to depression. So when we've looked at statistics and looked at outcome studies, the anxiety and stress often is the first or the precedent or the first part of it. But if it continues too long, when a person has certain other risk factors and chemical changes in their brain and their body, then it can become depression. They're not the same, but they're often co-occurring and connected to each other.
Good. Any additional comments about that, Dr. Bills?
No, I think Dr. Silbert covered that well.
Great. Are you able to, let's see if there's anything else in here. Again, we're getting some great comments and questions in here. We're going to follow back up with you.
Hey, Kendra, I wanted to, do we have a minute for another one of the questions?
Absolutely. Go ahead.
I noticed there was a question about antidepressants and whether or not they are addictive, as well as anti-anxiety pills, and I thought maybe we could touch on that, and I'll make a couple of comments, and Dr. Silbert probably will want to add something, but actually we didn't get into the specific area of medications, and certainly antidepressants have an important role to play for many people who do have a significant major depression. But I will say antidepressants are not addictive, so that's good news. And although it's confusing, and this is a really common source of confusion, antidepressants are actually great as anti-anxiety medications. So the good news is that type of medication isn't addictive. But I know maybe Dr. Silbert, you might want to add something else on this topic.
No, I think once again we're on the same page. I think it's a great thought to talk to your doctor or your practitioner, about whether you could get help with anxiety from an antidepressant medication, because unlike the medications that got so famous that they're in the movies and in our culture, like Valium and Xanax and even Klonopin and Ativan, those medications, they can become addictive. So having alternatives is awfully important, and doing therapy and counseling and healthy stuff is very, very important too. So I think the suggestion that the antidepressants, could help with anxiety really has often kept people away from addictions and dependency. Thanks.
And then
thank you for commenting about that. Go ahead. What were you going to say?
Kendra, and I was just going to mention, another common question is there a difference between anxiety and depression? I saw that question. And there are, sometimes depression has a lot of anxiety mixed in with it. Like I mentioned, agitation or somebody feeling kind of irritable could, some people may think, oh, they're just more anxious. There are certainly specific anxiety issues, but it wouldn't be uncommon for somebody with depression to have some anxiety symptoms as well, even if they can be very distinct.
Great.
Kendra, if it's okay, I wanted to comment on one kind of sophisticated question. Is that okay? Do we still have time?
Absolutely. If you're comfortable commenting, please do.
Okay. One of the attendees asked whether Alzheimer's was connected with depression. I'm going to, in a sense, work that question backwards. What we've noticed is that when some folks, especially as they get older, get a biological depression, when the chemicals change in their brain and their body, they do get forgetful and increased rates, and that's sometimes called pseudo dementia. So it doesn't mean that Alzheimer's or dementia always causes depression, but on the other hand, it's often important to have a healthcare practitioner. It's often it's a psychiatrist, but other practitioners can help figure out that the cause of the memory problems isn't part of the depression. Now, if a person does, decide to say have a serious form of dementia or Alzheimer's, they are not immune to depression, and sometimes when being sort of stuck in a confined, like it could be a nursing home or facility, the lack of activities or the lack of as one of the other attendees had written in, sensory stimuli could lead to depression. So it's certainly not impossible. They aren't the same, dementia and depression, but I think that one of the many different aspects of depression is to slow down our thinking, and that can look at times the same as dementia. So I thought it was a great question.
Well, good. Well, I'm glad that you commented on that, because I think there's so much surrounding this, and again, I'm seeing so many great comments and questions that have come in, and I want to certainly let our members know, or if you are asking a question, we are going to respond to you. If we don't get to it today, but the Resources for Life program is available. We have resources on our website, and this series. I had mentioned that we have the previous slides and recordings that are available on that website. It's upmchealthplan.com/intouch, and you can certainly use some of those resources to tie everything in together. It is a very difficult time, and a time in society that we have not experienced in these recent years. So there are a lot of feelings that, they might feel like you're grieving over the loss of your life, or your busy life, and your activities and your schedule, and not being able to see friends and have those interactions. I mean, that's really hard for all of us. So I think, like Dr. Bills and Dr. Silbert had mentioned, you have to know what is normal for you and how you're feeling, and when to reach out for assistance or help. And I think that, at UPMC Health Plan, we have a wealth of resources that can guide and help you, making a plan, working with a health coach, using how to use the Brain Manager app to help decrease stress and put you back into a mindfulness state of mind, living in the moment and not trying to worry so much about the future. So I think that's very important. And this coming Thursday, we'll have another one of these talks at noon, and it will be episode 6, Staying Connected from Home. Now more than ever, it's important to find ways to stay connected with your family and friends and healthcare providers. And we'll have Ellen Beckford, who is Associate Vice President for Population Health and Clinical Transformation at UPMC Health Plan. And she will walk us through ways that you can see and engage with your loved ones using your smartphone. And we'll also have Michelle Palmieri with her, who is a Senior Manager of Telehealth Operations and Implementation. at UPMC Health Plan, and she'll give an overview of the telehealth platforms that are available to you, and also provide instructions on how to visit with your doctor or healthcare providers without leaving home. And I know that we mentioned this as well today, but it's UPMC has always we've sort of been on the cutting edge of a lot of these technologies, and they're working very well for our members right now. So it's nice to see that folks are utilizing these resources. And I think that wraps it all up. I was trying to add a little airtime because we did still have some folks that are being screened, and once we disconnect, they will get disconnected. So if you had a question that came through, we will follow back up with you. And do you have any final words you'd like to say, Dr. Bills or Dr. Silbert, before we disconnect today?
No, other than to thank you all for sharing some time with us, and stay safe and stay positive as best you can. Thank you.
Yeah, I would echo that. I really appreciate everybody's input and lots of great questions, and I'm glad we'll be able to get back to everybody.
Great. And again, we look forward to hearing from everyone. Everyone joining us again on Thursday at noon. And have a great day, everyone.